Hey everybody, Melissa Etheridge here. I'm a 21-year breast cancer survivor.
Everybody, I'm Joan London, and I'm proud to say that I'm an 11-year breast cancer survivor.
It's about thriving. It's about putting yourself first.
If breast cancer is detected early, survival rates are now close to 90%.
I know we like to put everybody else first sometimes, because that's what we do, but we're no good for anybody else unless we put ourselves first.
Knowledge is power. It can save your life.
Welcome back to GMA, and as Joan London said, knowledge is power. Well, this morning, we're celebrating 40 years of Pink, 4 decades since the launch of Breast Cancer Awareness Month, and we're happy to have an audience filled with thrivers. That's right. And also these 3 experts to bring us the latest in breast cancer care and answer questions from the women here. We have our chief medical correspondent, Dr. Narula, Dr. Shanti Sivendran of the American Cancer Society, and Dr. Monique James of Memorial Sloan Kettering Cancer Center. Welcome to all of you. Welcome. It is, give it up one more time. Great to have you all here. And thank you three for being here to answer all of our questions. Dr. Sivendran, I want to start with you. Where are we with survival rates, with treatment, and the latest advances that matter most to patients right now?
Well, this is a really incredible time, celebrating 40 years of progress in breast cancer. If I take you back to 1985, 1 in 3 women were getting their mammograms, and we had really limited access to innovative treatments and screening technologies. And now, 40 years later, 2 out of 3 women are getting mammograms. We've had a 40% reduction in breast cancer mortality, over 5 million breast cancer survivors. And this is all thanks to this amazing innovation in breast cancer. As we look ahead to the next 40 years, some of those things that you're talking about, like vaccines, AI, those are really important parts of jumping forward into the next 40 years. So something like cancer vaccines is actually prime time for some cancers right now. We use it in bladder cancer, we use it in melanoma, we use it in prostate cancer, and we'll continue to make that kind of progress with cancer research. And when we think about AI, that's great technology to help us do things like augment our ability to read mammograms and augment our workforce. So when I look forward, I think this is a really exciting time for breast cancer.
It is so exciting as somebody who, my mom has overcome breast cancer, and so many people here are dealing with it in so many different places in their life. Dr. James, I want to talk to you a little bit about managing, because now lives are being prolonged. Yes. People may not even be cured, but they are managing that cancer. How do they deal with the emotional impact of that and the mental health impact of that in the long run?
Yeah, such a huge and important question. And with 40 years of breast cancer awareness and research, people really are living longer with the disease. And so you move from a state of shock, a state of crisis, even a state of survival mode, into more of a state of maintenance. It's almost like living with a chronic medical illness. And so how do you do your best to go with that? You actually learn to walk with uncertainty, you learn to walk with unpredictability, and a lot of the mental and emotional challenge is how you do that. It's interesting, right? One of the best ways of walking with uncertainty is actually planning, actually doing, actually having action, right? You plan for the now so that you can actually plan for the future, but you start now and
Hope
start in the
takes
present.
action.
That's right, that's right, it's a verb.
Another key word, resilience. You've just written a book, Dr. Narula, called The Healing Power of Resilience. How can women facing cancer cultivate it?
Yeah, George, I mean, when you are sitting in that exam room or you're at home and you get that call that says you have cancer, it is literally a moment where you are paralyzed, for many women frozen in fear, and your whole world is turned upside down. And so really in that moment, what we hope to do with the book is say that you can change a stress response into a resilient response. And there are ways to do that. Psychology tells us in the book, we talk about things like acceptance and flexible thinking and exercising, supporting your body's strength, focusing on hope and optimism and connection. So there are strategies you can use in that moment so that you can really move forward. And you're never going to be the same, ever. But you can find a new normal, you can thrive, and you can have great quality of life and meaning in your life. So for me, resilience is that light that really helps you find the path in the darkness. It's a great skill to cultivate.
Indeed. Dr. Sivendran, after breast cancer surgery, a lot of women have decisions to make about reconstructive surgery. What can you tell women about the options available today for them?
Yeah, it's a great question. So reconstructive options have come a really long way. And when I think about those reconstructive options, sort of divide them up into what we call flap options and implant options. So flap options are ones where we're taking tissue from some other part of our body and we're moving it to the chest and creating a breast that way. And that can be taken from various different parts of the body, and we're using skin and blood vessels and tissue, sometimes muscle, and moving it to the chest. And then there are implant options, so using saline or silicone implants to try to recreate the breast. But I think it's important to also understand that reconstructive surgery is not the only option, right? So there are many women who decide that they just don't want to go through another surgery, right? That can be really hard. And embracing the figure that they have now, right? And that's a great option. And then the second is for women who don't want to go through a surgery, but still want to have some shape underneath their clothes. There are special bras, prostheses in those bras that you can use to create the shape. But at the end of the day, it's what the patient themselves values and what they can work together with their healthcare team to create.
Great, thank you.
It's so great to have you guys and to talk about the options. But Dr. James, now that we have options, we have to make choices. So you say, because at one time we didn't have options, right? But you say there's some questions that people should ask themselves to choose these. So what are they?
Definitely. So one of the first questions I always ask, right, is what do your breasts mean to you, right? So not what have they meant, but what do they mean right now? And when you ask that kind of question, you get the values, right, of that person. You get how they see themselves as they move through the world, right, how they walk through the world and present themselves. Once you have those kinds of values about that person, we can start to help guide them a little bit better with the decisions. And a big thing that we say all the time, right, it's not about a worse or a better outcome. It's about that it'll be different, right? So it's not going to be the same. It'll be different, but different is something that we can tackle, something that we can cope with, something that we can adapt to. And so remembering that we still have all these tools with us for that.
And Dr. Narula, you're a cardiologist. You say women should pay attention to their heart health, especially after going through radiation and then chemo. What questions should they be asking their doctors?
This is so important, Michael, because as we've seen advances in breast cancer treatment, and we have 5 million survivors, what a lot of survivors don't know is that cardiovascular disease is still lurking as a big threat. We know it is the leading cause of death for women. And in fact, with breast cancer, there are a couple of reasons why they could be at risk. One is there are shared risk factors. So things like obesity, sedentary lifestyle, smoking puts you at risk for breast cancer and also cardiovascular disease. But the second is, as you mentioned, many of the treatments that we give women, chemotherapy and radiation, can cause early accelerated coronary artery disease or plaque in the arteries. It can damage the heart valves. It can damage the heart muscle that can lead to heart failure or even heart rhythm problems. So it's important when you get discharged to make sure you have a record of your chemo and radiation, that you set up care with a cardiologist to look at your risk factors and also potentially get screening with ultrasounds and other tests that they might recommend.
And now it's time to hear from the thrivers in our audience this morning. Lara and Sam are speaking with all of them. Take it away, guys.
Will do, Rebecca. And I'm here now with Amanda McElroy. Come on up. And Amanda, you have a question. Go ahead and share it.
Yes. I'm 42 years old, and I'm a 4-year survivor of stage 4 triple negative breast cancer. What strategies help manage fatigue, cognitive changes, or other side effects while returning to work or other daily routines?
Amanda, thank you for bringing attention to a really important topic. So what you're describing is a side effect of going through cancer treatment that can be chronic and can make it difficult for patients to, return to the workforce or to just be able to return to their normal, where they were before. And that can be mild or it can be debilitating, right? And anywhere in between. So as I think about some potential sort of action items that a person can do, the first one is get moving. Get your body moving and get your brain moving, right? So going for those walks, being deliberate about exercises, puzzles, all of those things. The second is they're all things that we value in our lives, and prioritizing those things of value and putting our energy behind those, right? Sometimes we try to do it all, and that's really difficult. everybody has a team of people that they can lean on, and that's the time you lean on the team to help you do those other tasks, right? And so, and then if despite some of those things that we're talking about, that you're still having trouble, it's really important to loop in your healthcare team. There can be some really formal ways to rehabilitate both physically and mentally, and get that additional help that someone needs.
Thank you.
Right. Thank you.
Good question, good answer. Shannon, Vic, you've got a question. Shannon, if you would stand up. I was reading over your shoulder your question. It's a good one. I think a lot of people will have the same thing. Go ahead.
I'm 46 years old with 4 children, and I'm a 12-year thriver of metastatic breast cancer. My question is, the word cancer is scary for an adult, let alone a child. So do you have any advice for mothers on how to talk to their children?
Such an important question, and 12 years, right? It's just amazing,
Yeah,
amazing. So kids, we all have different kinds of kids in our life, right? Sometimes they're our own children, sometimes they might be nieces or they might be nephews, right? The first thing to remember is that most kids of all ages can usually sense or realize that something is up with their parents, with the adults in their life, right? And so with that, you never want the child to be alone with the questions that they might have. So the number one recommendation is to say something. So what do you say, right? That's the big thing here. It's okay for parents to feel unsure. It's okay if you don't know exactly what to say. It's okay if you even practice what to say. But our recommendations are that it's age appropriate, that it's familiar language that you use with the kids. You might also think about who you want with you to tell them, right? And that it might actually be a series of conversations that you tell the child, right? You give them a heads up, maybe of any physical changes that you might have. And the last thing, of course, the most important thing coming from me, the psychiatrist, right, is that you allow them to express their emotions. You allow them to express their feelings. And they might see the emotions in you. That's okay too, right? Because you'll model for them how to deal with emotions and feelings.
Wow, very, very important
stuff.
Thank you.
Thank you, Shannon.
This is Lisa Lefebvre. Hi, Lisa.
Good morning.
What would you like to ask the doctors?
Thank you. I am 41 years old. I am a 1-year breast cancer survivor. One of my biggest fears as a breast cancer survivor is recurrence. So what advice do you have for a breast cancer survivor who wants to enjoy life but still carries that fear?
That's such a great question, Lisa. And, you know, we talked earlier about what happens in that moment when you get diagnosed. And I think fear is so normal. And I would ask everyone here, how many of you felt afraid or still might feel afraid?
Yeah.
Almost everyone, right? So the important thing is to normalize it, to understand that that's part of the reaction. And I hear this a lot with my patients who have cardiovascular disease or have had a heart attack or a stroke. What if it happens again? And the advice I often give them is to say, don't focus on the future. Focus on the present moment. Put one foot in front of the other. Don't worry about something that might never happen and let it take away the joy from the moment that's happening right now. And you will also find that as time passes, time really is a healer. We say that, but as you get farther and farther and farther away from the event, the fear gets less and less. It never goes away, but it gets less present.
Thank you. Thank you so much.
An excellent question, Lisa, and all of you. Thank you for your questions. Thanks to all of you for the great answers. So much value. Ginger, over to you.
Thank you, Rebecca. And as we've just heard, and now I'm surrounded, we've got thrivers there, thrivers here. We know that a diagnosis of breast cancer is a life-changing moment, and the American Cancer Society wants to help. They have a wide range of items, from wigs to bras to post-surgery recovery tools, like a lot of those that you see right here. They're all available to support you through this challenging time and help you remain ever you. For more information, you can scan the QR code on the screen.
And we are back with Dr. Tara Narula, Dr. Shanti Sivendran, and Dr. Monique James, our audience of thrivers. We have some more questions there.
Thank you so much. Janelle Adams. Hi, Janelle, come on up here. You have a question for our doctors.
I do. I'm 37 years old. I'm 2 years in remission from stage 3 triple-negative breast cancer. My question is, how can survivors be more included in shaping clinical trials and researchers so our voices are heard?
It's a great question, Janelle. So I'm going to leave everybody here with 2 action items today. The first is your voice is powerful in advocating for cancer research. cancer research is a nonpartisan issue, right? We need to use our pressure to make sure that cancer research is continued to be funded so that we can move this progress 40 years into the future. The second is be a participant in clinical trials. Clinical trials are the way that we advance innovation in cancer medicine. It can be difficult to take part in clinical trials. There are a ton of barriers in taking part in clinical trials. We recognize that at the American Cancer Society. And I encourage you to check out our Access to Clinical Trials and Support program, where we help get you matches to eligible clinical trials, but also help mitigate those barriers like transportation, lodging, financial difficulties to getting you to that clinical trial. So use your voice to do cancer research advocacy and to participate in clinical trials.
All right, great. I think we've got time for one more question. Candace, do you want to take it?
Sure.
Candace Jeffrey.
Good morning. Thank you. I'm a 7-year breast cancer survivor this month. My question is, there are many women who decide on the holistic way of treating cancer. Is there a safe way to go both routes, holistically and medically?
Great question, and thank you for that. So the first thing with holistic medicine is that you do have to talk to your oncology team about it, right? Sometimes with these medicines, even though they're over the counter, they might actually interact with chemotherapy, with immunotherapy, with even hormone therapy. So the number one thing is to talk with your oncologist about it so that we can see if we can then incorporate both. A lot of times people want holistic medicine for a state of wellness and well-being. And so that's what we always want to prioritize with our patients, and then this way we can see if we can do both of them at the same time.
Thank you. Thank you, doctors. Thank you, all of our thrivers.
Thank you, guys.
For more
Thank you.
information, scan the QR code to take you to goodmorningamerica.com.